Sago, greetings. I'm Christine Venery. I'm the mental health director here at the St. Regis Mohawk Tribe Mental Health Services, and I'm participating in this question and answer regarding COVID-19 questions, and specifically I'll talk about mental health issues today. So we all know we've been going through this pandemic for the past year. And one question can be, how does a pandemic affect mental health? So this is a collective stressor that we're all going through, even maybe a collective trauma for some of us that we're all going to. So it can affect our mental health. That would be normal for us to feel anxiety, depression, and due to being having to be socially isolated, that can be very difficult too, because having social supports and interactions with others is really can helps to improve our mental health. So yes, a pandemic can affect our mental health in lots of ways. What's important now to do in terms of what we can do to monitor our mental health would be really to focus on self-care, making sure you're eating right, sleeping okay. A lot of people have asked about their sleep that during the pandemic, saying that sleep has been harder during this time. Some people either are wanting to sleep a lot or not able to sleep, and that's also a normal reaction given to what's happened to us now. So it's important to make sure you take care of all those areas in your life. What are some ways to take care of your sleep or to improve sleep hygiene? One of the things would be to make sure you're avoiding caffeine after noon, having a regular bedtime and wake up schedule, trying to avoid screen time, going on your phone or watching TV at night. Other ways that can help you is doing physical exercise during the day as well, and that can improve both your sleep as well as your emotional health and your well-being. Another question people ask is how can we cope with this stress and anxiety that we're having? So during this pandemic and COVID-19. So it is normal to feel stressed and anxious during this time. These are normal reactions to a stressful situation. So one thing we recommend is, minimizing your news intake sometimes, or really looking at what information you're taking in during the day regarding the pandemic. Another thing is to be able to acknowledge your feelings and to reach out for help and talk to someone. That's very important. It's a sign of strength to ask for help. And, the message is that it's normal to have anxiety, stress, depression during this time. How can we support others that are having social and emotional effects from coping with the pandemic? I think the most important thing is being able to listen, encouraging people to seek out help if needed, and keeping in touch, even if it's by text, checking in on people, letting them know that you're concerned about them as well can help. Some people after having COVID-19 ask that they're not feeling like they're themselves, and is it common to have depression after having COVID-19? So if you have had COVID-19, the coronavirus, it is normal to have feelings of depression, anxiety after the illness. I mean, your body is connected to your mind, and it can affect you But I guess the important thing is if these symptoms of depression or anxiety continue and last, it's important to be able to reach out and ask for help. What are some of the ways to help yourself in terms of your social and emotional health during the pandemic would be trying to develop a daily routine and structure in your life, trying to figure out what are some of the things that you enjoy to distract yourself. So I've heard from folks that have been able to use this time to develop hobbies or take on beading or crafts or basket making or learning how to crochet or knit. Starting a daily gratitude practice can help us cope, to really focus on what we can be grateful for in our lives. And like I said before, also developing an exercise routine and making sure that you're also taking care of your physical health needs as well during this time. I guess one more question people might have too is having to grieve during a pandemic. And that's been a difficult thing. The mourning has changed. Our grief process has changed because of the pandemic and not being able to gather and do any of the same kind of ceremonies or services or rituals that we normally do. And that can affect our grieving process. And it's important to recognize that it's different. And if people need help with coping with their grief and loss, then that's also an important thing to be able to reach out for help for as well. You know, we've all suffered these different losses through this past year. It could be loss of having a wedding or a graduation or any of the kind of normal things where we would gather together and support each other. And that's all been a loss for this past year, and it's affected us. So it's important to recognize that and important to be able to talk about your feelings regarding that. What are the resources? Where can I go for help? We provide individual, family, family and couples therapy here at our mental health services. We also have an after hours crisis line if you ever need to talk. So our after hours cell phone number for the St. Regis Mohawk Mental Health Services is 518-651-4475. So New York State has, New York Project Hope has an emotional support line, and that number is 1-844-863-9314. Another concern that people ask about is it normal for me to increase drinking or drug use during this time? And what we're finding is that there has been an increase in drinking and drug use during this time as a way for people to cope with the stress. And we have our drug and alcohol department here as well available to help folks that are going through that. And then you can also call the Project Hope line, which is in New York State, for help with accessing services for drug and alcohol abuse 24 hours a day, 7 days a week. And it's called the Hope Line, and it's 1-877-8-HOPE-New-York. Or you can text to 467-369. Another resource for people who don't want to talk on the telephone is a crisis text line, and you would text GOT5, GOT, the number 5 to 741-741. Right now, that's, I think, all the questions for now. but feel free to contact ATV if you have any other questions, or our mental health program, which can be reached during the day, Monday through Friday, 9 to 5 at 518-358-3145. So just make sure you all take care of yourselves and your loved ones, and you know that it's a sign of strength to ask for help.